Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing some special treatments for plantar fasciitis, or as it's now beginning to be termed, plantar fasciopathy. And the drive to change that name has to do with the fact that the suffix itis tends to imply there's inflammation. But in plantar fasciitis, we don't really see any inflammation. So very similar to the fact that not all tendinitises have inflammation, so they use the term tendinopathy to be more inclusive or more general or sometimes even more accurate. Well, in the same way, they're trying to rename plantar fasciitis plantar fasciopathy because in very few of the cases do you actually see inflammation. I might slip up a few times during the video, but hopefully you get the idea. Now, when I say special treatments for plantar fasciopathy, I don't mean we're treating the diagnosis, because never in physical therapy do you treat a diagnosis. You treat the impairments, which is why it's important to conduct a very thorough, objective examination. And you'll probably look at the ankle and foot, obviously. You may even look at the knee and the hip. But of course, with plantar fasciopathy or any condition, you're going to address any of the major impairments. And so let's look at some of the common ones for the general foot and ankle assessment. So here's your general foot and ankle assessment. And while any of these things could be an impairment, the ones bolded in red are the ones that I most commonly see in a plantar fasciopathy. Usually strength is not an issue. I mean, you might have some 4+s, but generally there's not significant weakness. I've only seen one case of that. And that's usually because the weakness that people have is usually from an acute injury to the foot or ankle. It could be a neurological condition, but usually a gradual onset like plantar fasciopathy, you really don't see a lot of strength deficits. What you do see are limited range of motion at the big toe and limited dorsiflexion mobility. And if you want more information on how we go about treating these individual things, I'm going to have a whole series on this where we cover the best treatments for each of these impairments. So make sure to take a look for that in the coming months. The other thing you might see at the subtalar joint is excessive pronation. You can have excessive supination here and get plantar fasciopathy, but more commonly it's going to be pronation. In terms of the medial arch here, they may have a positive navicular drop test, which is where you have that flat foot or pes planus, which is also commonly associated with excessive subtalar pronation, and also weakness of the muscles that lift the arch up, like abductor hallucis. Speaking of, at the hallux MTP joint, they may have impaired activation of the abductor hallucis, and very important to plantar fasciopathy is hallux valgus, or a bunion, which we'll also be covering in a couple of minutes. And so you address all these impairments, even the ones that aren't highlighted. Maybe they do have strength deficits in the ankle. You, of course, want to address all of those. You want to address foot, ankle, knee, hip, lumbar, spine. I don't care what it is. Address those. However, in plantar fasciopathy, there's a couple commonly overlooked issues. And if you don't address these, it can, in some cases, delay their recovery, and it can also cause reoccurrence later on. Plantar fasciopathy, things like that, tendinitises, they tend to be recurrent if you're not fixing the underlying issue. Okay? If there's weakness, absolutely address it. If they got limited dorsiflexion mobility, absolutely address it. But some things that are overlooked: shoes with a narrow toe box, hallux valgus or a bunion, even if that bunion is mild. And you can see a bunion over here on the right side of the screen right there. That is a bunion or hallux valgus. And people don't just end up with a bunion. Okay? It's not like you're genetically predisposed or we're born with a bunion. Okay? We get bunions because of improper footwear. And that footwear is shoes with a narrow toe box. So I'll be focusing mainly on this in terms of the mechanism of how this can contribute to plantar fasciopathy. And if you're not convinced, I'll put a paper in the description of this video that actually talks about this in a lot more detail. But the gist of it is you have shoes with a narrow toe box. So that narrow toe box is compressing those toes together like you see here, okay? You can almost picture a person having a shoe on over this, and it's bunching all the toes together, okay? On the digiti quinti side, digit 5, yeah, you can end up with a tailor's bunion over here, so a bunionette, okay? But we're mainly concerned over here on the big toe, the hallux side. So if you imagine shoes with a narrow toe box, presumably you're wearing these shoes every day or most days, and when you're wearing them, it's probably multiple hours. So you're chronically in those narrow toe box shoes, chronically having those toes pressed together. So you're chronically putting that big toe into passive hallux valgus, okay? Now, there's a muscle over here on the medial side of the foot, the abductor hallucis. Abductor hallucis is responsible for a few things, but one of them is actively pulling this toe into abduction. Now, it's not technically abduction, but they're naming abduction according to the midline of the foot right here, not the midline of the body. It's technically adduction, but you get the point. There's a muscle here, and it pulls the toe out like this. It's also responsible for elevating the medial arch of the foot. Okay, so it does a lot of things. But when you put this toe into passive hallux valgus, it causes a tightening of this abductor hallucis. And there is a blood vessel, and that is the lateral plantar artery, that tends to respond adversely to this. So when this muscle, abductor hallucis, tightens chronically, it tends to restrict blood flow through the lateral plantar artery, or portions of it. And one of the branches of the lateral plantar artery serves the plantar fascia. And it's not like the lateral plantar artery is getting occluded 100%. No. It's a little occlusion, just a little bit, but over time it adds up. And so it causes degeneration of the plantar fascia, leading to plantar fasciopathy. So this is not an inflammatory condition. This is why things like ice and other similar modalities tend to not do anything. This is a degenerative condition. And it's not like cartilage degeneration that has a difficult time regrowing. This is just connective tissue. So it can regenerate if you give it the proper stimulus. So what is the proper stimulus? Well, you fix these issues right here. So if you have a person with plantar fasciopathy that has shoes that have narrow toe boxes, it is in your interest, and their interest too, to very early on recommend corrective footwear. So you can go on all sorts of websites and you can look for shoes that have a wide toe box. That's the first thing that probably needs to be done. Could you get this plantar fasciopathy better without doing that? Yeah. Is it probably going to recur sometime down the line? Yes, if you don't correct the footwear. And then even if the bunion or hallux valgus is mild, I'll almost always recommend somebody use toe spacers. And this toe spacer up at the top, this is the most common one that I recommend. You can search for these on Amazon, although most drugstores like CVS, Walgreens carry these as well. The nice thing about this type of toe spacer is you don't have to have all the toes spaced at once. I usually recommend people start by putting it in the first web space between the hallux and the second toe. And the nice thing with these is you can slide your sock on over it, shoe on over that, and just walk around and go about your day. And you really forget that these are in. Unless you just have hypersensitive web spaces for some reason, most people will say that they don't even notice it. I've used these myself. They work really well. You can even stick one in the second web space, but that's usually the max that I will ever have people do. And that's usually when it's a really significant bunion, where it's a lot of valgus there. But for most people, one of these is sufficient. Now, this type of toe spacer down here, this is one piece that spaces all 5 toes at the same time. You really can't put a sock on over this or put your shoe on over that. This would be something I just recommend at the end of the day. So you're home from work, home from school, whatever it might be. You're going to kick back, watch some TV, stick this on for 30 minutes, an hour, and just let those toes space apart. But when you're going about your day, this type is really the best. And one thing I'll also tend to work on for some people is actually getting that hallux to move into abduction, out of that valgus position actively. So doing a little bit of active range of motion and very, very, very gentle resisted range of motion. So a little bit of resistance there. It's not a particularly strong muscle to get into the more varus position, so more normalize it. So it does not take much resistance. Usually I'll do it more isometrically. But the big thing you want to get these people to do is actually be able to activate that muscle volitionally and practice that. Get that muscle active, because remember, that muscle's been chronically tightened. It's probably very weak. And so just at least getting active range in that abductor hallucis is going to be very important. But I would say the toe spacers and then correcting the footwear are the biggest things here. And if you can loosen up that muscle and restore blood supply, and you can get people into good habits early on, you can really prevent or at least dramatically reduce the risk of recurrence of this years and years down the line. So, hopefully this video gave you some good ideas in the treatment of plantar fasciopathy. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.